Hi, this is Chuck Gallagher. My guest is Valda Ford. We've been talking about men's health, especially prostate health. And Valda, you gave us some great information about early warning signs.
Well, you made a point of talking about your father-in-law who was diagnosed late. And a lot of times the body tries to tell us, so it's told us, okay, you're having difficulty peeing, you're having difficulty with an erection. And maybe we ignore that. And late signs can be things like pain in the pelvis, bone pain, swelling, and don't ignore that. Say if you're a person who has some heart disease, then you might be accustomed to seeing swelling one place or the other, or your legs having edema. But pay attention. Your body is really trying to tell you something. And the best thing we can do is to pay attention, to take it seriously. Worst case, keep a diary of what you're seeing happening. So if you're having the difficulty, say, to ejaculate, and it's happening once a month, and you are a guy who is 50 plus, you probably have bought into the fact that as you get older, you're going to have these issues. There are always people who tell you, well, you're a certain age, you should expect this, you should expect more problems with erectile dysfunction, but that's not really true. Sometimes the first sign of heart disease is erectile dysfunction. So anytime something changes and it's not going back to normal, because it can change because you have a fever, or you just have the flu, any reason, new medication, check with your healthcare provider, because it might be a simple fix and you're right back to normal.
You know, that's interesting the way you put that, because in my father-in-law's case, he was in his early 50s. There probably were some signs that he ignored because, well, after all, I'm in my early 50s, and it isn't as, well, he was not as sexually active with his wife as I'm sure one time they were. And I think he went in because he had bone pain, you know, had pain. And by that point in time, the diagnosis was prostate cancer, but it had spread to the bones. And again, in 1980, while there was a radical prostatectomy, there wasn't the same types of treatment that there is today, and obviously that led to his demise, as it has with many people like Dan Fogelberg.
Right. Well, stage 4, and that's where he would have been, where it's gotten out, where it's gone through the lymph system and gone to all your different organs. That is something that, for any kind of cancer, is very unlikely to go back to normal.
Sure.
The most important thing for men is to have that annual PSA once they're 45 to 50 or earlier, depending on their history and their race. Also, though, to have that digital rectal exam, and to be very open with your healthcare provider. If you're someone who doesn't want to say, Doc, I can't get my penis to rise, take a piece of paper in with you, slide it over to them. They will read it, save you from saying it, and give you the answer you need.
Well, that's all valuable information and part of this series of men's health, and especially prostate health. My guest is Valda Ford. You're a nurse, have multiple master's degree, deals with a lot of issues of sexuality, and thank you for your candor. And we're going to continue this discussion as we talk about what happens when you do have prostate cancer, the types of treatments that are available, and the things you can expect and should prepare for as you think about what those treatments might be.